Hi Beauties, my name is Dr. Stefani Kappel and I'm a board-certified fellowship-trained cosmetic dermatologist in Newport Beach, California. And today I'm going to be doing a video on filler, migrated filler, and the process of dissolving filler, and just different changes that we're seeing in dermatology now that it's been 20 years since fillers have been routinely used in our practice. So the reason why I wanted to film this video is because I see patients every day in my office, and my practice is 100% cosmetics and aesthetic dermatology, and I've seen more and more people coming in asking for their filler to be dissolved or asking, why is my face changing and what needs to be done? And when we dissect the problem and dive into their history or other providers that they've been seeing, we've noticed that there's been a lot of filler that's been placed probably way too much, way too fast, and over more than one, possibly even 2 decades, and how the composition of the filler can change and how it can migrate and how it can make your face look different than it once was. Not looking younger or better, but just different and not like yourself and almost more distorted. And things that we're seeing now that it's been 10 to 20 years since fillers were first launched, and Juvederm was one of the first fillers launched so long ago, and even ones before that. But with the launch of like Voluma, I believe was probably like in 2013, 14, around that time, higher G prime fillers that had been injected into the face, and how they are not only migrating but also changing the chemical structure and the molecular configuration of the product, of the hyaluronic acid. And this is with all hyaluronic acid fillers, not just Voluma or higher G prime fillers. We're seeing it with everything, but different fillers and different molecular compositions of these fillers, different injection planes, and just variations of how these fillers are being injected into different areas of the face. And not only that, over time, injecting filler and more filler and more filler for the wrong reasons. For example, to tighten skin. You don't use filler to tighten skin. You use tightening devices or use lasers. But a lot of providers, unfortunately, have been just pumping up their patients full of filler. And now, years later, patients are starting to look distorted or not like themselves. So I kind of wanted to do a video just to address this issue, and because I'm seeing it a lot in my clinic, people being referred to me to dissolve old filler or filler that they're not happy with, and also people who have been doing filler for a very long time and are not getting out of it what they used to get out of it. So hopefully this helps. And before I move on, I ask that you like and subscribe and share this channel with anyone who may find it useful, or anyone who wants non-sponsored content by board-certified dermatologists. I feel on YouTube I'm one of very few dermatologists these days who you won't see coupon codes, you won't see me promoting products, or you won't see any paid sponsorships with different companies, Neutrogena, CeraVe, Cetaphil, La Roche-Posay. I don't accept any paid partnerships, and that's not to say I don't support these companies or like some of their products. I just never want to be bought or sold by any company, because truth and honesty and authenticity is so important to me and my patients, and being able to have this back and forth and recommendations of treatments and products that I really feel are truly best for my patients, and just based on years of 20 years in practice, and just what I've learned along the way in my education and training, sharing this with you, because I feel like everybody's like an infomercial or like a commercial these days. Most doctors like on YouTube and social media, and that's nothing against them. I feel that as long as they're disclosing that they're doing paid partnerships, that's fine, but I just choose not to, because I want to be able to change my opinion and really recommend treatments or products or procedures to my patients which I feel are best, not because I'm in contract with some company to do so. And on that same note, if something changes, or I don't like a product, or I don't feel that a treatment or procedure is best for my patients because something new comes along, or because an existing product is having some long-term side effects or something that we didn't know about before, I want the freedom to be able to recommend these treatments to you and just speak freely with you. And when you do paid sponsorships and you're in contract with companies, you just can't do that. So I will always stay true to that. I have my entire career since the day I graduated, and my mentors have taught me well, and that's the most probably important bit of advice that I got from my mentors. So again, just share this content with anyone who may find it useful, because the only way to grow on social media is by word of mouth and just organic growth. But that's my intention, and that's the way I practice, and that's the way I feel is best. That's my ethos. So going into dissolving filler, migrating filler, overfilled faces, let's just kind of go back in history and see how these fillers were engineered to be injected into the face. So fillers, usually are used in nasolabial folds. marionette lines. Voluma was launched not recently, gosh, it was like 2014, but later on as it changed the whole filler game because it had a very high viscosity and the cross-linking was different. It had what we call high G prime for like cheekbone contour to lift up on the cheekbones and kind of to lift below along the jawline when used off-label. There's different fillers that kind of have come on the market, and we're seeing now that the composition changes, and we used to think that they would stick around for 6 months, 12 months, 18 months, 2 years, and now sometimes we're finding that people are having the filler stay in their skin for a longer period of time. Now that's highly variable. That's not for everyone. It just depends on the individual patient. It depends on the individual filler, how it's injected, where it's injected, and how many times it's been injected. So these are all very variable pieces of data that have to be considered when you're talking about migrated filler or filler that's lasting for longer than 2 years. So each individual patient is different, each individual product is different, and the injection plane and technique in which it was injected in can also vary and can determine the outcome, whether it's going to be metabolized or stick around longer or change its molecular configuration to kind of give a different effect than was intended. I also think it's important to note this epidemic of overfilled faces that we have entered and are hopefully now gradually exiting. And it's hard to determine why, because as a cosmetic dermatologist in Orange County, there are a lot of injectors in my neighborhood and in my area. Now, very few of them are dermatologists or fellowship trained, for that matter, in aesthetics. They're usually, medi spas owned by an OBGYN who want to cross over to the aesthetic space, or, there's nurse practitioners who may not have had, 4 years of medical school, 4 years of residency, 2 years of fellowships, and really understand how these fillers perform and how to avoid having bad complications long term. When you have a higher level of training, you understand the physics and the pharmacokinetics and the molecular structures, the cross-linking, like we talked about earlier, the G prime, high G prime, low G prime, the injection planes and injection techniques, and just the skills that you acquire over years of training and experience. And I feel that there's no regulation and there's not a lot of accountability when injecting patients. I mean, I go to different offices and I teach, and I'll be astounded sometimes when I see injectors who are actually paying patients, and they're kind of just winging it on the fly. And I feel that there's been a lot of overfilled faces, and I don't know if it's because people are just giving way too much filler way too fast, or they're injecting it inappropriately, or they're not turning down patients when when a patient may not benefit from a filler. They benefit maybe from like a tightening device or another treatment. So filler has its role, and its role as a tool in our tool bags. But it's not just fillers. When somebody wants to lift up on the sagging lower face skin, you don't just like plump them up full of filler and kind of alleviate the problem for like a year or two, because then a year or two later they're going to need more, and then they're going to need more, and then they're going to need more, and then they're going to look this distorted cat-like faces, weird version of themselves. And there's a couple plastic surgeons who you probably follow, who I follow, who have really made a point of this, and even when they're doing surgery, they see filler under the skin. Now, as a cosmetic dermatologist who does a lot of filler in my office, I definitely support that, and I agree with them. The filler is maybe sticking around a little bit longer than we thought it would. It's changing its molecular configuration to where it gets really water balloony and like a weird kind of puffy Tyndall effect outcome, and it's not performing how we thought that it would. And now that's not to say the filler doesn't have its role. I had clinic today, I saw 30 patients. I did a lot of filler today, but I also did a lot of lasers, tightening devices, peels, thread lifts, minor surgical procedures in skincare and reinforcement of skincare. And it's all of these things together that helps with a well-balanced, rejuvenated cosmetic outcome. And I feel that sometimes in spas where they only know how to inject, I mean, anybody can they may not do it well, but it's easy to just open a syringe of filler and just pump somebody up full of filler. But it's harder to have a higher level of expertise where you're taking like a pico laser, like this guy behind me, knowing what settings, what fluence, what spot size, what wavelength to use, and just to kind of combine all these treatments to make someone look better. So I feel that filler has just been on the rise in the last couple years because it's the easiest thing to do, and people have a lot of first-time patients that never come back because they'll get 10 syringes of filler at one treatment, and then the provider will never see them again, probably because they feel that they look weird or they were unhappy with the result. But I feel like just from going to different conferences, and even, I'm going to be honest, because I always never want to say anything bad or negative, but I also feel it's good to give some insight on to backstage what's happening behind the scenes, because when Allergan had its Volux launch last fall, and I was looking to my right and looking to my left, and the colleagues who are usually there at these events with me, the more highly trained dermatologists in the field of dermatology who are usually at the podium and lecturing and doing lots of clinical trials and patient cases, they weren't there. And it was interesting to me because the people who were there were the offices who had purchased the most product from the company. Now, I feel like the company has made some changes since then, because I actually even said something. I'm like, where are my colleagues? Like, where's my homies? Where's all the board certified fellowship trained aesthetic experts? They're not here. It's these people who are being rewarded by going to these conferences by having the most filler, having the highest invoice, paying the most for the most product. The more astute clinician is the one who's the highest trained and who has the best outcomes, not the one who gives the most filler. And I remember sitting on this bus, we were going to this anatomy lab, and some person next to me was saying, I don't have one patient come into my office that doesn't get less than 10 syringes of filler. And I'm like, oh my gosh, I mean, not to be this like super ethical, derm police, but it's like, as a physician, I've had a different level of training, and there's patient care, the Hippocratic Oath, all that goes into it of do the right thing. And I feel that this is the reason why people were having these balloon crazy faces. And I feel strongly about it now too, because I've had a couple patients in my office who come to see me, and usually not people who usually come to see me in my office want very natural results. They love my conservative approach, and we go in a stepwise fashion. You don't do too much too fast, and most of my patients kind of vibe with me on that outlook and expect that type of treatment. Once in a while, I'll get somebody who does not need any more filler or already has, more than enough filler in their lips or in their face, and I'll say no. And if you're a patient of mine and you've heard me tell you no, I do that. And I'll say, no, we don't need filler. Wait and see me in 6 to 12 months. Or let's do a light laser resurfacing or something that will help be preventative or help the quality and texture of your skin, not just fill you up, because I'm just doing you a disservice. I could charge you for 10 syringes of filler. It'd be very easy to do. But it's more important to me that you have a good outcome and you look and feel your best, and not just to give you as much filler as I possibly can. And unfortunately, I think that that's what's happening out there, and it goes along with what I saw at this launch for Volux back in the fall. And I remember this other person saying, oh yeah, I never give less than 10 syringes. I pump so much, I can give this many injections in this amount of time. And I'm like, you guys are going at it all wrong. It should be treating the whole patient, the whole face, the balance of it, not just putting a bunch of filler as much as you can. And it's just, it's something that just really made me sad after I left that conference. And I just feel that the pendulum swinging one way, and hopefully we can swing it back. So I'm the school of thought of of course, filler definitely has its role. If you follow me on Instagram, you see my stories every day. I post real live content every day. We do jawline filler. We do marionette and nasolabial fold filler, tear trough filler, temple filler, but only in combination with other things, and only when it's in balance with the face. If someone's doing this and they want to lift up on their skin, you don't put a bunch of filler to stretch out the wrinkles. You tighten the skin, or you use an energy-based device to stimulate collagen to tighten it, because guess what? If you do filler to lift that laxity, you're going to look okay for maybe a year or two, and then you're going to need more and more and more, and that's when you get into this deformed faces and just looking weird. So I never posted that after coming back from that conference, but it is something that's just been in the back of my mind. And I'm like, do I do a YouTube video on this? I don't want a bunch of people getting mad at me for, criticizing the way they practice. And I'm not naming names, but I just want you guys to know, as patients out there, the goal of some of these people is just to give you as much filler as possible. On that note, knowing what we know, there's a lot more than just filler to rejuvenate the face or to lift, tighten, and pull. Treatments that are more elegant take a little bit higher level of skill, so you may not find providers on every street corner that do it, but when you find a provider who's highly trained and can come up with a treatment plan, a little bit of filler here, a little bit of laser resurfacing, a little tightening device, medical grade skincare, using photoprotection, things like that over time will definitely benefit you. So now going back to why we were talking about why we have these deformed faces and so much filler. Even filler that has been done correctly and precisely and by the book by somebody who's highly trained, you still may see over time a change. And I actually had this done too myself. I was having voluma in my cheekbones, and I hadn't had it in, gosh, I think like 2 or 3 years. And I felt like it was moving, and I felt like it was changing my face. And I'm like, I haven't done filler in 3 years because I'm trying to shy away from filler. Sculptra was usually my main filler to kind of fill in my mid-face hollows, especially when I lean out and I work out every day, and I'm pretty petite and small and lean, but I also lose it in my mid-face. So I would use Sculptra, which is a biostimulatory filler, but I also have done hyaluronic acid-based fillers in the past too, especially when I was younger. Now that I'm older, I do more lasers and tightening devices, and I think that keeps you looking normal, and I feel like the skin texture and quality is more important than getting rid of folds or getting rid of, the best way to get rid of laxity and fine lines and wrinkles is by tightening the skin with, lasers and devices, and not stretching it out with a bunch of filler. But I feel that in the past when I was younger, I'd wanted lips, I wanted cheekbones, and I wanted jawline, and I wanted all that stuff. But now that I'm older, I don't hopefully have any more of that filler left. But any filler that I did have left, I felt like it was just making me too full here. So I had one of my colleagues dissolve all the filler, and it was interesting because it was migrated filler. And what happens with filler is it changes its consistency. It's, say for example, let's use Voluma, not to pick on Voluma. I love Voluma. I love all Allergan products. I think they're some of the best out there. But Voluma, what's injected along the cheekbones, will look beautiful for 2 years, say. But then over time, if your body doesn't metabolize it, the molecular configuration can change, and it binds water differently than it did before. And it kind of migrates, and it shifts, and it moves, and it gets this weird, like very fluctuant, which in medicine, fluctuant just means kind of like water balloony, like flaccid, not strong and bouncy with turgor, but just like kind of loose, floppy, Tyndall affected, meaning there's like a blue kind of hue to it, like look to it. And this happened to one of my good friends who's also a YouTuber, and she actually posted her experience of dissolving filler, and it happened to her too, and I dissolved a little bit of her filler and it went away. Now, what happens is when filler sticks around for longer than we thought it would. Again, sometimes it does last as long as it should, but on some other people, it does stick around for longer, and it does change the molecular configuration, and it can get this weird texture. But once you dissolve it, you can start from fresh. You can refill again if you want. And I feel that that's what's happening at a lot of our academic meetings. People are saying, okay, we need a fresh, clean state. You don't just keep adding filler year after year. You dissolve the filler that's there, see where the baseline is, and then start doing filler again. So I'm not saying that filler is a bad thing. I love filler, and it's a big, important part of my practice. It's a tool in my toolbox. But like I said, sometimes we need to dissolve it all and start from scratch. And the hyaluronic acid-based fillers are beneficial because they are reversible. So even if you do have migrated filler, even if your filler looks weird and strange, you can dissolve it. Now there's a mental issue that comes with it too. You have to mentally be prepared when you get your filler dissolved that you may look sunken, you may have aged for the 1 to 3 years that have passed since you had it at your baseline to begin with. And filler can stretch out the skin, especially like in the tear trough area here. If you get your filler dissolved, your skin can look crepey, it can look laxed, but usually if you're using good medical skincare products, if you're using medical grade skincare products, if you're having laser resurfacing, or even if you don't and you want to tighten that skin up with a laser or CO2 ablative or non-ablative, or even like a clear and brilliant laser, it will help the texture of your skin, and your skin will go back to how it was before, usually. Now, my more mature beauties, they may need a little bit more help getting the skin back and snapping back after all that laxity has happened after dissolving filler. But again, you have to be mentally prepared and mentally stable enough to know going into dissolving filler that you may look a little bit different, and it may age you a little bit. But doing, like I said, laser resurfacing devices and using, retinol, vitamin A derivatives, things like that will help bounce your skin back. It's kind of like having a baby and being pregnant. You don't deliver the baby and then you're kind of back to where you were before when you leave the hospital. Before having my 2 kids, I thought, I'd be leaving the hospital and I'd be back to normal. No, it takes a minute for that stretched out skin to kind of go back to how it was before. And you can think of filler as being pregnant, and dissolving it is when you deliver the baby, and that skin has to just kind of regain its elastic recoil, regain its strength and turgor, regain all those extracellular matrix proteins that have been fragmented and dysfunctional because of the skin being distended out after filler. So again, I'm not saying filler's not a good treatment. I do it all day, every day in my practice, but it's not all I do. And when I do use filler, I never do too much at once. And I turn away patients all the time who want filler, who already have too much filler. And sometimes I'll even say, let's just dissolve and start from scratch if you want more. Or we'll just say, wait a year or 2 and see where you're at. And doing a little bit of filler in different places is really important. So for example, in the lips, I usually just do half a syringe, or maybe a whole syringe if someone has been, has a larger surface area or wants a little bit more plumpness to their lips. But I'll never do 2 or 3 syringes, and I know some of my colleagues do, and that's just setting yourself up for a disaster. It's stretching out the skin, it's distorting the skin, and it's not going to look good in the long term. So what's the take-home message from this video? If you've had filler and you feel that it's migrated, or you feel that it's changed the consistency, and the way you can tell is if the filler's not looking like it did 1 or 2 years ago, and you feel like you're fuller, or you feel like it's looking different, or your eyes are getting smaller, or your cheeks are getting bigger, or in pictures you're starting to just not look like yourself, if your family, your friends, your loved ones are saying, you're looking different, or what did you have done, and you're looking at pictures and you look dramatically different, it's time to dissolve your filler. And we see this with celebrities too. I know that one of the award shows, Madonna, got a lot of slack for the way she was looking, and was it plastic surgery or what did she have done? It was filler, and it was too much filler. So to avoid altering the way you look, don't get too much filler too fast. Go to somebody highly trained who you know and trust, and don't let anybody give you too much, especially in the same place. Again, if you're doing it in the jawline, the temples, the tear troughs, in different areas, that's a lot easier and safer than doing like 6, syringes in the jawline. So just use common sense and just know that over time, filler is lasting a little bit longer than we had anticipated it to, and it doesn't stay in the same place. And when it changes that molecular configuration, it can have a different effect than it did when it was first injected. So I hope this makes sense. I hope this answers your questions. And I just think that we're going to see a lot more videos and increased awareness about overfilled faces, how to reverse migrated or bad or too much filler. And hopefully the pendulum will swing from an era where we were doing too much filler to more focusing on the skin, which is where my heart has always been. Lasers, tightening devices, skincare products, photo protection. You can't get new skin. You can pump your face up all you want for filler to try to erase fine lines and wrinkles, but when you look back and you look in the mirror and you see how distorted it looks, that's not the way to go long term. You can't get new skin. So baby the skin you have, take care of the quality, the health, and the texture of your skin, and that will keep you looking like the best version of yourself for as long as possible. All right, you guys, thank you so much for your support. Love you, and let me know, drop a comment in the comment section what you guys want me to talk about next week. And I hear you, I see you. I try to respond to all my comments within the first 24 to 48 hours of me posting the video. But you have to remember, during Monday through Friday, I'm in the office seeing patients and treating my beauty. So I'm away from my computer. But I see you and I hear you, and leave as many comments as you can and let me know what you want to hear about. And then also, I always give preferential treatment to my subscribers. So be sure to like and subscribe, and share this video with anyone who may find it useful. Thank you.